Hi, my name is Giselle and I will be doing a medical assessment today. I have my proper PPE on, my environment is safe, and I checked that once I first arrived. My number of patients is 1. Hi, my name is Giselle, I'm your EMT for today. What seems to be the problem?
I have a lot of chest pain.
Chest pain. And from that I could tell that my mechanism of injury or illness is chest pain. I will call for additional resources, and if they are not needed, I will cancel. There is no need for C-spine since our primary concern is her chest. My general impression when I first arrived to the scene, I found her sitting down, clutching her chest, and from that I know that she is alert and verbal since she is responding to me. Her chief complaint is chest tightening and pain. Her airway is patent since she is responding to me. Her breathing seems shallow. Can I check your pulse, ma'am? Her pulse is present and it is stable for now. I will not make this a priority patient since I will stay in play and try to figure out other resources that we could use to try to stabilize her. And what seemed to provoke this?
I was just sitting in class and I just started feeling a fuzzy feeling on my chest and it started hurting.
Was there anything going on in class that might have you a test?
Yeah, we were about to take a test and I think it's just that I didn't study.
Okay. So how would you describe the feeling?
It just feels really a itchy feeling. It's fuzzy.
Fuzzy?
Yeah.
And would you say your pain is just in your chest, or do you feel it going to your neck, your arms?
I just feel it in my chest.
Your chest, okay. So from 1 being the lowest and 10 being the highest, how would you describe the pain?
I'd say like a 6.
A 6. And how long ago did this happen? How many minutes into class?
I say 20 minutes in class.
20 minutes into class, so by now would be about 30 minutes ago. Okay. So from my signs that I see is that she's clutching her chest. She has shallow breathing. Her symptoms: pain in the chest, tightening. Do you have any allergies?
I do not.
Any medications?
Yeah, I take medication for my anxiety.
Anxiety, okay. Any past history?
No.
No? Okay. What was your last oral intake?
I just had an apple.
An apple in the morning?
Yeah.
Okay. And so the events leading to this was you sitting in class preparing for a test, correct?
Yes.
Okay. So from that, I will focus on her cardiovascular system since that is our main priority right now. I'm going to reassess her vital signs. Can I check your pulse, ma'am? And her pulse is still stable and present. Her respiratory rate is still shallow, so my field impression when I first arrived was I found her sitting down. She seemed worried, clutching her chest. She seemed in pain. So for my intervention, I'm gonna hook her up onto oxygen, 15 milligrams, and I will hook her up with a non-rebreather mask since she might be having the starts of an anxiety attack. And that concludes my medical assessment.